What has changed in celiac disease diagnostic guidelines? Imagine a world where getting diagnosed with celiac disease is faster, less invasive, and more accurate. That's what recent updates to the diagnostic guidelines aim to do. Let's explore what's new and how it impacts you. First, in some countries, children can now be diagnosed without an invasive procedure called an upper endoscopy with duodenal biopsy if their blood tests are strongly positive. This means if a child has high levels of tissue transglutaminase IgA antibodies and other criteria are met, they might avoid the need for a biopsy. This change helps reduce stress and discomfort for young patients. Second, a new tool called the epithelial lymphogram has emerged. It looks at immune cells in the lining of the intestine and can identify celiac disease with about 98% accuracy. This test can sometimes serve as an alternative or complement to traditional biopsies, especially in tricky cases. Third, serologic testing remains central to diagnosis. The main initial test is measuring tissue transglutaminase IgA antibodies. Doctors also check total IgA levels to rule out IgA deficiency, which can cause false negatives. For children under 2 years old, IgG-based antibody tests are recommended because IgA tests are less reliable at that age. It's important to do these tests while the person is eating gluten regularly, as going gluten-free beforehand can lead to false negatives. Fourth, when serologic tests are inconclusive, or if someone has already started a gluten-free diet, doctors still relying on endoscopy with multiple duodenal biopsies to confirm the diagnosis. Taking several biopsies from different parts of the duodenum improves accuracy. Fifth, genetic testing for HLA-DQ2 and HLA-DQ8 genes is increasingly used. If someone has already started a gluten-free diet, or if other tests are unclear, a negative genetic test can effectively rule out celiac disease. But a positive result doesn't confirm the disease because many people carry these genes without having symptoms. Sixth, gluten-free oats are now generally considered safe for most people with celiac disease. This reflects a better understanding of oats and gluten cross-contamination, expanding dietary options for patients. Seventh, the guidelines now emphasize setting personalized goals for a gluten-free diet. The focus is on healing the intestine and improving quality of life, with support from experienced dietitians. Eighth, mass screening of the general population isn't recommended anymore. Instead, testing is targeted at high-risk groups like first-degree relatives or those with autoimmune conditions to catch cases early. All these changes mean a smoother, more accurate diagnosis process. Some children might avoid biopsies, testing results are more reliable, and genetic testing can clarify in certain cases. Maintaining a gluten-containing diet during testing is crucial for accuracy. Dietitians now play a bigger role in guiding recovery and lifestyle adjustments. Including gluten-free oats safely broadens dietary choices. These updates aim to make diagnosis faster, less invasive, and more tailored to each person's needs.